guys. I hope everybody had a great day. We are back with yet another exciting topic. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going over the top 3 exercises for frozen shoulder. So it is important for me to explain what frozen shoulder is to begin with, because so many people come in here with a frozen shoulder diagnosis and it's not frozen shoulder. So the medical term for frozen shoulder is adhesive capsulitis. So what that means is basically the capsule that surrounds your shoulder has frozen. If you can move your arm up over your head, no matter how painful, you don't have frozen shoulder. All right? It may be excruciating to lift it all the way up there. That's a shoulder issue, but it's not frozen shoulder. And I do get a lot of people who come in here that have a diagnosis of frozen shoulder and yet they have this range of motion. Frozen shoulder means you basically can't lift it past here. No matter what you do, I can come over here and I can push as hard as I want and it is basically not going to move. It is stuck. You have a frozen shoulder. It is frozen in place. Now you can move down here pretty much pain-free. All right? Nothing down here is going to hurt. But the minute you go up here, you just can't move it any further. A lot of times it doesn't even really hurt. Once that capsule freezes, like here's your range of motion. So you get to the end and you're like, okay, it's not really painful. Now sometimes that end is painful, all right? But that is frozen shoulder. You cannot, no matter how hard you crank, get this shoulder past a certain point. So it's just important that you know that. Why do you get frozen shoulder? A couple of reasons. So a lot of times frozen shoulder can happen after a surgery. If you don't get moving your arm right away, if you keep your arm guarded, if you don't follow your physical therapy, you can wind up with a frozen shoulder and it's not going to move. More common frozen shoulders come out of the fact that one day you injure your shoulder. You may fall on your shoulder, you may just work out too hard, you may reach over your head and feel a pain. A lot of times frozen shoulders actually occur on the opposite side of your dominant hand. So why does that happen? Because usually what happens to develop a frozen shoulder is you have to stop using it. So if you reach over your head and you're like, oh, that just hurt. And every time you wind up reaching overhead and it hurts, you're going to stop reaching overhead, especially if it's your non-dominant arm. So as you stop reaching overhead, you stop loosening up that capsule. In order for your capsule, in order for you to maintain this range of motion in your shoulder, you have to use it on a fairly regular basis. Now, because it's your non-dominant arm, you're not really keeping track of, oh, did I reach overhead? Did I move it today? Usually, I'm a righty, so this is just my dominant arm. But usually if this shoulder is sore, we don't think anything of just doing everything with our right arm. Not a big deal. But it is a big deal because that's how frozen shoulder develops. Because once you stop using it, that capsule starts to literally freeze up and it stops being able to allow you to move. So you wind up just lifting it and oh, it still hurts, so you don't lift it anymore. Each time you go to test it, it still hurts. So you just stop lifting it until one day it doesn't really hurt anymore, but that's all the further you could go. Now, you are not necessarily limited by pain, meaning this is not the furthest you could go. You could push it all the way up here if it really, really hurts. Again, that's not frozen shoulder. This is frozen shoulder. I don't care how hard you push it, it's not going anywhere. All right? So just make sure you understand the difference. A lot of times we deal with rotator cuff tears that are diagnosed as adhesive capsulitis or frozen shoulder because it's like, oh, it's just painful. I don't want to move it up here. Not wanting to move it and not being able to move it are two different things. So we have the two ways basically that frozen shoulder can happen. It also can become, it happens traumatically. You fall on that arm and it develops over time. Either way, frozen shoulder develops over time. It's not something that you're going to wake up tomorrow and be like, oh, I have frozen shoulder. I just fell on it yesterday and it's already frozen. It doesn't happen like that. It takes a couple weeks for that capsule to start freezing and that shoulder to start losing range of motion. So what can you do when you have frozen shoulder? So you got a couple of things. First of all, you want to grab a stick, a broom handle, doesn't matter. This is the first thing you're going to want to do, is you're going to start doing range of motion to your shoulder. So let's say this is my frozen shoulder, all right? You're going to start, you want to put the thumb on the end, okay? and you're gonna use your right arm to push your left arm up. Now, one of the biggest mistakes I see with this exercise is this. I cannot tell you how many times I've seen people do this, all right? Now you're just causing frozen shoulder. Not only you're causing frozen shoulder, now you're creating yourself some neck pain. Actually just irritated my neck just doing that. So you wanna make sure you're pushing your shoulder down and keeping it down as you're raising your arm up. Now you're still gonna get to a point you're like, I can't move it any further. That's okay, that's where you stop. You just wanna continue. Nice and easy. You can also do this laying down. There's nothing that says you need to be standing up for this, but you want to make sure that you're doing this and you want to hold it up at the top for as long as you can tolerate. Even a minute or two, that'll help. What you don't want to do is keep it up there and then have the shoulder slowly raise up. You will always get more range of motion if you raise your shoulder like this. So it's not a case of, oh, I'm going to go here. A lot of people like to trick themselves and do this and then gain more range of motion. Not the range of motion you want. You're going to wind up herniating a disc in your neck. You're going to wind up with neck issues. So you just want to, again, put the thumb on top of that stick, and you're just going to rotate or lift your arm up as far as it'll go, nice and easy. I recommend doing this for 5 to 10 minutes, a couple times a day. It takes a lot to loosen up a frozen shoulder. This is not something that's an easy fix. So make sure when you're doing this, you're doing enough repetitions. Just doing 10 of these isn't going to do anything. It's not really going to loosen up that capsule. But if you do this throughout the day, 5 to 10 minutes, nice and easy. Again, and it's this arm doing all the work. I'm just pushing up, and then I'm bringing it back down. Pushing up, and I'm bringing it back down, nice and slow, okay? Again, holding it at the end. Next one is range of motion into external rotation. This one is going to be out. Now, again, you want to make sure that you're not doing this. You're not working on straightening your arm, all right? You're working on rotating out. So you're rotating out. So you want your elbow bent to 90 degrees. Again, this arm is doing all the work. You can do this laying down. You don't have to be standing up like I am. And you are going to have your thumb out like that. And you're just going to push with this arm and rotate out. Your elbow is going to stay glued to your side, and your elbow is going to stay bent. Don't start doing this. Again, you're not working the capsule when you're doing this. Okay? Elbow bent to the side, rotate out, nice and easy, nice and slow, okay? Again, you want to hold this out as long as you can. A minute or two is not too long when you're doing this. You want to do this for 5 to 10 minutes, nice and slow. If you can do this a couple times a day, the better. This is not a set of 3 repetitions 10 times is going to do you anything, all right? Nice and easy. You just want to rotate that out. When you get to that end point where you feel like you can't push it any further, push it a little further, all right? You are going to feel some pain, especially at that end range. That's okay. If you have adhesive capsulitis or frozen shoulder, it's going to hurt at that end range, especially as you try and push it past where you want to. So really make sure that you are pushing it to being uncomfortable, all right? I recommend that if you do have frozen shoulder, you get it treated professionally. We offer free consultations. All you have to do is call our office at 215-997-9898, and we'd be happy to get you in. But it does take us a pretty good amount of force in order to help loosen that up. And I don't always recommend just cranking on it by yourself because you can actually tear things in the process of cranking. So be very careful with these exercises that you're doing. If you have frozen shoulder, don't just have somebody come over and push it as hard as they can and be like, oh, I just want to break it up, because you're actually going to wind up tearing something. So again, if you do have frozen shoulder, I really recommend you getting it treated professionally and not doing anything at home to jeopardize any of the muscle integrity. As of this point with frozen shoulder, if all you have is frozen shoulder and you don't have a muscle tear, okay? Maybe after you get it treated, maybe there is an underlying muscle tear, but if all you have is frozen shoulder, that's not a muscle tear. That's just a capsule that's really, really tight. So getting it loosened up is all you gotta do, but if you push it too hard on your own, you can make a mistake and you can tear some muscle. So just be careful of that. All right, the final exercise you're gonna do with frozen shoulder is you want to start to strengthen around it, okay? So you're going to just squeeze your shoulder blades together, all right? Nothing crazy. You just want to, nice and easy, start to strengthen that muscle in the back, okay? Those muscles in the back. So just squeeze, hold for 5 seconds, and then back down. Now this is one that you can do 3 sets of 10 for. You don't have to do it 10 minutes at a time. You just, because again, this is just a strengthening exercise. So just nice and easy squeeze, and then come back down to help loosen up that capsule, to help open up that shoulder joint. That will help. it is really important that you figure out if you actually have adhesive capsulitis before you go through all these exercises, because you may in fact have something other than adhesive capsulitis. We see it misdiagnosed all the time, and when you do have it, it takes a special type of treatment in order to be able to fix it, and if you don't have it, then we have to figure out exactly what's going on. If you or someone you know is suffering from shoulder pain and want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.